Are you concerned about fraud in the light of COVID-19, and have you heard of any scams going on right now?
Yes, I am concerned because what we know is these scammers will take advantage of every single situation, and they'll take advantage of our most vulnerable populations. They've targeted the elderly in the past regarding different scams, a lot of phone scams, email scams. We believe that this is going to cause some people to come out of the woodwork to try and steal money from people. So please be cautious out there. Don't send any money over the phone. When people call and say they can expedite the federal check for you, if you just provide their social security number, your bank routing numbers, all that other stuff, please don't do it. The federal government is not going to do that. During this time too, people want to take advantage, through the normal systems, like they say too. You have a warrant, the sheriff's looking for you, please pay this, we can take care of this warrant over the phone. We will never do anything like that. So be concerned, be leery. People going door to door, offering services at this time. Please be leery of any of that stuff. If you do fear that there is fraud among a phone call or someone going door to door or someone trying to take advantage of someone during this crisis emergency, please call us. Call your local jurisdiction and report it. We would love to come out there and speak with those people.
Okay. And then what about people who are wanting to give money to help with COVID-19?
Right now there's a lot of great nonprofits that are out there right now that are supporting our cause, of sheltering the most vulnerable populations, Food for People, the Rescue Mission, Betty Chin. There's a lot out there. So if you can, please support these organizations. Our JIC is going to get together a list of places that we would love for you to support, but also we have Humboldt Area Foundation that has a disaster fund set up. And if you want to write a check, that's the area where you need to focus your money on, and you want to write a check for it, then that'll get to the places that we believe needs it the most.
Sounds good. And so Supervisor Bone has stated that they're in the process of acquiring 44 rooms to house the vulnerable and need to be quarantined people. Can you tell us a little bit about that project, what you know?
So state, we have local funds, we also have state and federal funds that we can use to house the most vulnerable populations right now, such as homeless, those are 65 and older and have underlying illnesses and those kind of stuff. So right now, Department of Health and Human Services is working with our community, has identified some rooms, has secured some rooms, and so we're in the process of trying to look at this long term as well. And so they may be in the process of purchasing a property, purchasing more rooms, leasing space for that purpose. And so our goal is our number one priority is to house the most vulnerable homeless population. Also have an opportunity for people that do get tested positive or need to be quarantined and they can't go home because there's more people at home and they need to be isolated away and they don't have the means themselves to isolate in a motel room, then we're going to provide them that space. But the Department of Health and Human Services is developing a plan and is working with our local community to identify this space. And if you have any questions, you can call them at Department of Health and Human Services.
And so we've seen that the National Guard has been deployed in other states for response and shutting down some cities, things like that. Have you been in any conversations with our California National Guard and how those resources might be deployed?
So each National Guard troop is controlled by that governor. So Governor Newsom has control of our California National Guard, and we can make the request to our local EOC, and I'm the director of the local OES. I can make the request if I think National Guard troops are needed in our county. Right now, we do not need those resources. They have been deployed around the state, but it hasn't been into a law enforcement capacity or to assist the sheriffs of the county. They've been deployed to help with logistics, moving food back and forth, moving equipment back and forth, setting up things, hospitals, respirators, those kind of things for the response. So that's how they're being deployed right now by the governor and the Department of Office of Emergency Services of California, Cal OES. So that's what they're doing as a support role. But they're there in these type of emergencies to be called upon at any time. So the sheriffs, all 58 of us, are looking at that and have that in our back pocket that we can ask for and deploy if necessary.
Okay. And then kind of shifting gears, let's talk about domestic violence in the light of COVID-19. How has our procedure in addressing domestic violence calls, has it changed since the shelter-in-place order has went into effect?
So domestic violence laws are still there, they're on the books, and it hasn't changed how we respond to domestic violence calls. Obviously, we're using caution in any contact, but if someone calls because they're in a fight with their spouse or roommate, loved one, those kind of things, and violence is used, we're mandated to take a report, we're mandated to make an arrest. And those arrests will get processed, in the county jail. So that is something that we continue to enforce. We haven't seen a major increase in domestic violence calls. This is probably one of the main calls that we do go to, family disturbance type calls. So we do think, over the course of this next month or so, we could experience more calls because of it. People confine their house. The level of stress and frustration boils over, and people get in arguments and fights, and the only thing that can resolve it is law enforcement. So we understand that. It is one of the most concerning crimes that we go to. A lot of emotion, a lot of passion involved, and so we understand that. We want to be empathetic, but also we're very rigid in what our discretion is. If someone uses violence against another, it's their spouse, loved one, significant other, we will take enforcement action. We have no choice other than to do that. So we urge people at this time to be patient. If they need to take a timeout, go for a walk, please do that. Distance yourself if you feel like you're getting to a space where violence is looking like a possibility. So distance yourself, and you can always call local resources that we have. The domestic violence hotline is 443-6042. You can call that number and request assistance. Also, if you have an active case right now with the district attorney's office, they can still help you here. Victim witness is still operational. They can still assist you with this. 445-7411 is their number, or 445-7417 is the direct line to victim witness. So please use those resources, and you can always call a friend, try to de-escalate those situations as much as possible.
Absolutely, thank you. Let's talk about our law enforcement officers locally. Do we have any reported cases of COVID within our local law enforcement?
No, not yet. We don't have it. We know that it's a possibility. Any day now, one of our first responders could come up and test positive for COVID. I know that there's been 2 officers around the state that have now died from COVID-19. It is a concern from all of us as far as first responders go. And so we're out there dealing with this on a daily basis. So our concern is for their safety and security. So that's why we're handling things a whole lot different now. But that is a major concern right now.
Sure. And then finally, this week, federal prisons ordered inmates to be locked in cells for 14 days. Is our local jail following suit in that? And then if so, how are inmates being mentally stimulated to not feel like they're in solitary?
Yeah, our jail facility has gone through many steps to, number one, prevent COVID from coming into the facility. We're doing our best to make sure that our correctional deputies are checked every day, make sure they're not coming in, bringing it in. We are sanitizing, disinfecting. We've set up requirements for people to come into the jail. So we're screening everyone outside the facility in our sally port for any signs that they're sick. If they're sick, they get sent off and dealt with. If they're well and they're going to be booked into our county jail, we isolate them for 14 days. So they're in a separate unit, isolating. Our nursing staff checks them every day, multiple times a day, checking their temperature, checking for symptoms. If they go 14 days and they're still asymptomatic, then we move them into the general population. And then there's room for more people to come in. So that's the last thing we want to do is put people at risk. Right now, our correctional facility, we do have, in the normal dorms, we still have different activities for our inmates. We still have our educational platforms, our tablets that they can utilize. They can still, utilize the phone to call friends and family. So there's a lot of things that they can actually do to help stimulate and stay busy inside.
Sure. Is there anything else that you'd like to share with the media or the public today?
Right now, I just want to, again, enforce the fact that the shelter-in-place order is in effect, and we understand that the tremendous impacts that has on people. We want people to respect that order, to social distance as much as they can, and to make sure that they honor this, because right now, this next 30 days is going to tell us how long we're going to be in this. And so we really want people to respect it. We believe that if we take this self quarantine or self isolation, social distancing model to the nth degree, to the most effective way possible, that we could be at a height of our curve by the end of this month. We're hoping that's the case. We don't want to see this go into June, July. We want to see this over with in the next 30 days and on the downward side. And so, but we have to be diligent. We have to make sure that we adhere to the doctor's orders and we respect those, and call us if you see that there's someone that's out of compliance.
Thank you.
Thank you.